Armamentarium is my gown, gloves, mask, glasses, my Marques probe, and a floss. The Marques probe is a double-ended, unpaired assessment instrument. It has a flexible, simple shank that is circular in cross-section. It has a blunt, rod-shaped tip with no cutting edges. The markings are sectioned by color by 3mm markings, and they go up to 12 millimeters. It is used to assess the health of the periodontium, measure the cowl, recession, width of attachment, size of intra and extraoral lesions, bleeding areas, determine mucogingival relations, and to monitor the longitudinal response of the periodontium to treatment. You want to ask your patient if they have a history of gum disease or if they have any concerns with their gum tissues. For 8 and 14, you place your patient in a supine position with chin tipped up and the light at an angle. Probing depths on 8 lingual are 3, 2, 3. There's no recession, no bleeding. Probing depths on 14 buccal are 3, 4, 3. 2 millimeters of recession, bleeding, and the width of attachment is 2 millimeters. For 24 and 30, you would place your patient in a semi-supine position with their chin tipped down and the light directly over. Probing depths on 24 are 3 to 3, no recession, no bleeding, and the width of attachment is 2 millimeters. Probing depths on 30 buccal are 3, 3, 3, no recession, and no bleeding. You will next want to check the mobility. There is no mobility on 24, no mobility on 30. There is also no mobility on number 8, and there is a class 1 mobility on 14. You also want to check the frontal involvement on both the maxillary and the mandibular. You also want to floss for any open contact on 8, open contact on 14, open contact on 24, and closed contact on 30. You would also want to check any furcations with the neighbor's probe. Class 1, you can feel an indent. Class 2, you can enter. Class 3, you can enter and go all the way through. In Class 4, you can see clinically both Class 3 and 4. You can see radiographically. And lastly, you want to maintain asepsis.